Is Tracy. So tonight we are going to be talking about parasites, psoriasis, and panic attacks. Okay. So if you are here and you're joining us, please give a shout out. I don't know what the weather is like for you guys, but it is crazy wonky here in the Chicagoland area. We actually had like record highs in February. It was like in the 70s yesterday. And then we wound up with like life-size hail golf balls. Like they were huge for hail. And some people had damage. They were pretty darn big. And today it is high of like 32. So, and I think by this weekend it's supposed to be back into the 60s or 70s. So I'm like, oh my gosh, talk about like a whiplash for weather. But anyway, um so yeah, so tonight we're going to be talking about parasites, psoriasis, and panic attacks. So last weekend we actually had the full moon, and I'm just curious to see if what you guys noticed any of your symptoms really bad this past weekend, maybe leading up to this past weekend on the 24th. And maybe it lasted a little bit, a couple days afterwards, and maybe now you're feeling a little bit better. So please share in the comments, like maybe what symptoms you had or if they got worse. As far as being a nurse and working in the hospital setting, I'll share with you what we typically see in the hospital setting. And my mom was also a teacher, and I'll share with you what she saw in her students. So a lot of times in the ER, people would get braced to kind of find out uh, what patients would come into the ER. And a lot of times we would see an overcrowding of psychiatric patients, big, huge on schizophrenia, anxiety, depression, suicide. The ER was just hopping with psych patients, especially around the full moon. And we saw that all the time in the hospital. A lot of our dementia patients, even dementia patients, would start getting very, very confused, combative personality changes. It was just unbelievable on what kind of things actually happened in the hospital. You ask any nurse, and it was like a phenomenon, and we would brace ourselves to deal with these patients. And a lot of times we would need extra staff and we wouldn't have the staffing. And it was quite scary for the patients and for the staffing. But it was like a train wreck in the hospital because of so many ER admissions. And then my mom, she was a fifth grade math and science teacher, and she would see the students. They had ants in their pants. They couldn't sit still. They were very hyper. They weren't paying attention. Some of them were disrespectful more than usual. They had tantrums. They were not cooperative. So they had personality changes. Instead of being their sweet, loving self, they were hard to deal with. Does that sound like maybe something that you guys experience at home, even with your kids? I know for myself, I got very, very anxious. I didn't always understand. I would get very moody. I would even get depressed and start crying. So, one of the things that often gets missed is parasites in the United States. I think more and more people are starting to wake up to the fact that they do have parasites, and that parasites are an issue. And traditional Western testing is very inadequate for testing for parasites. They can do blood work, that still misses it, trust me. They can do stool samples, that still misses it. it is not very adequate because you can have parasites pretty much in every single organ. If you don't have it in your intestines per se, and maybe you have it in your pancreas, or maybe you have it in your liver, or maybe you have parasites in your lungs. Yes, you can have it in your lungs or your sinuses. I had one patient that turned around and was having severe bloody noses and a lot of sinus headaches and a lot of sinus issues. And we did a neti pot nasal wash with an herbal tincture. And after a couple weeks, she blew out parasites. I actually have pictures on my Facebook and my Instagram page um, of patients passing out parasites. Okay, we actually have the biggest parasite challenge in my office. So whoever passes out the biggest parasite or excretes the biggest parasite wins. Now, these things are dead when they, get rid of them because we've been working on killing them off. But they send me pictures of these parasites so that way I can share that with you guys. So I've had patients, like I said, blow out parasites out of their sinuses. I've had one patient that was having chronic bacterial vaginosis, and she had parasites in her uterus. And as we started killing them off, she was actually passing them out of her vaginal canal. So, as gross as that sounds, but it's much better than her chronically being on antibiotics, which the antibiotics were not helping because of chronic bacterial vaginosis was secondary to the parasites. So the parasites were causing an imbalance in pH levels in her vaginal canal, allowing the bad bacteria to kind of constantly grow. So once we handled the underlying cause of her having bacterial vaginosis, which happened to be the parasites, she stopped having bacterial vaginosis and hasn't had a problem since. Okay. So these parasites can be pretty much anywhere and everywhere. And they can cause a lot of anxiety for a lot of people, including depression as well. And in fact, there was a psychiatrist who actually did her own research, and she found out that she wound up doing an autopsy. So she took samples of brain tissue from people who committed suicide. And in over 70% of the patients that committed suicide, she found out that they had a parasitic infestation in the brain called toxoplasmosis. And her theory is that it's not that the patient wasn't producing enough of the happy hormones like serotonin, norepinephrine, dopamine, things like that, but that the parasites were actually causing a disruption in how the body metabolized that or absorbed that, and they were excreting their own toxins, interfering with that. And that's why the patients developed anxiety and depression. And we know that what happens is that parasites become more active around the full moon and the new moon. So if you notice that your symptoms getting worse within the week of a full moon or a week of a new moon, then we can pretty much think that it's parasite related. So what happens is your serotonin levels rise, which actually excites parasites. So the serotonin levels rise, melatonin um, levels drop, and then water levels change within your body. Okay, this is why like a lot of pregnant women actually, especially when they're in uh, their ninth month, they wind up going into labor around the full moon. And a lot of women go into labor at the same time because what happens is the moon actually has a stronger gravitational pull on the Earth's energy. And that's why like ocean waters level rise, all water level rises. Well, we're mostly made up of water. So that actually changes the water levels like intracellular, extracellular, which allows for parasites to become more mobile. And so the serotonin levels actually excite them. And that's why things like, and they're more active at night. So insomnia can actually be more prevalent. Nightmares can be more prevalent. Um, a lot of parasites can actually cause a lot of gut issues. So if you're actually more nauseous or you are more bloated or you have more IBS type symptoms, more diarrhea, more constipation, abdominal pain, especially around the full moon or new moon, chances are it's parasite related activity. So some patients will say that they feel more itchy at night, and it's only at night. Guess what? That's parasites. Now, the funny thing is that parasites can also cause so much inflammation in the body and release so many toxins because they have their own waste that they produce, and that can irritate the body. The body tries to excrete this waste and these toxins, and sometimes it can try doing that through the skin. And a lot of skin rashes or eczema and dermatitis, especially if they say it's atopic dermatitis, can be related to parasites. And actually, that's what happened with me. When I was younger, I had a combination of psoriasis and eczema. So I had kind of the flaky, patchy, dry, patchy skin, along with the really raised, bumpy, itchy red rashes. So I had a combination of both. And I had that since I was a kid. And I remember my skin actually cracking open and splitting in half, and my skin would be so itchy. And they didn't really have anything that they could put on my skin because I was really young. So my skin was really bad when I was a kid. And I wound up starting on allergy shots and I wound up starting on allergy medicine when I was a kid. And of course, my skin cleared up. But then when I was in my 20s, it came back with a vengeance. And I had gone to 3 different dermatologists. And each dermatologist, didn't know why. They tried me on different combinations of creams, of steroids, of compounds, different compound medications, and nothing seemed to work. Finally, the last dermatologist did a skin scraping and he found that I had something called scattered eosinophils, which is a type of white blood cell. Scattered eosinophils, eosinophils are seen in allergic reactions and parasitic infestations. So, parasites can cause an elevation in eosinophils. And so he said, "Oh, well, no, it's not from parasites." Because I had asked him, "Could it be from parasites?" And he's like, "No, that doesn't happen except for in third world countries." He's like, "It's an allergic reaction." So he stuck over 200 chemicals on my back, seeing what my skin would be allergic to. And guess what? I had no reaction. So after a couple days, he took a look at and he was like, "Oh, well, you have no reaction." I said, "Could it be from parasites?" And again, he said, "No, that doesn't happen unless it's in third world countries." He's like, "No, we don't know the reason why you have your symptoms. How many times have you guys been told, well, we don't have an answer for why you have your symptoms?" And then this is what I was told. And the doctor goes, and the dermatologist goes, "But here, take this pill. It will, your body is attacking itself." Okay. How many have you guys heard of that? Your body is attacking itself. Okay. Think autoimmune disease. Your body is attacking itself. That's what I was told. Your body is attacking itself. Here, take a pill. This is going to suppress your immune system. And I said, "Are you out of your cotton picking loving mind?" Said, "Really?" I'm like, "I got bronchitis at least this was way back when. I get bronchitis at least three times a year. I've gotten sinus infections umpteen times, and I get them several times a year. I work with patients who get TB in the hospital. I work with patients who have TB all the time." I said, "They tell you specifically, if you are exposed to TB or if you're exposed to blah, 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 these type of infections, please let your doctor know right away. It can cause serious life-threatening infections, may even cause cancer." I'm like, I don't need to be put on that. Yeah, just so I can have clearer skin. You might die from the cancer because it's a side effect of this medication, but you'll have clear skin. Yeah, no, I don't think so. At least I didn't want that. So I decided to try alternative holistic routes and approaches. And I did not tell the person who did muscle testing on me that the dermatologist found eosinophils in my skin scraping. So she did muscle testing on me and found out that I had parasites in my liver through muscle testing. And I was so excited that I actually had parasites in my liver because I knew then that was the issue for my skin. And I knew that was the root cause. And then she was able to find out what supplements my body needed to get rid of the parasites and support my liver. And it was not an overnight fix. It took me 8 months for my skin to start clearing up and a year and a half for my skin to be completely cleared. And I did get frustrated in the meantime, but I was patient enough to give it the time that it needed. And then it dawned on me, well, how long do liver cells live? Liver cells liver cells have a lifespan of 300 to 500 days. Okay? So if your liver cells are damaged, and when they die, they do replicate. Okay? So your blood cells, your white blood cells and your red blood cells, they replicate every 90 days. So every 3 months your red blood cells die and then they replicate and they form a new red blood cell. Okay, so they have a lifespan of 3 months. Liver cells have a lifespan of 300 to 500 days. So if they're damaged, you have to wait while we give you nutrients. So when they die, they can replicate a healthier version of themselves. So we're not masking your symptoms. We are trying to get to the root cause and get rid of it while giving nutritional support because your organs and tissues cannot replicate a healthy version of themselves. The cells cannot reproduce a healthy version of themselves if there's things that are causing it to be damaged in the first place. So we got to remove that while giving you nutritional support. And when that happens, healing can actually occur naturally. So I had parasites in my liver. And the funny thing is I wasn't expecting this, but my asthma and allergies went away. I stopped getting sinus infections 3 to 4 times a year. I stopped needing my inhaler. I stopped needing allergy injections. I stopped needing allergy medicine. And the reason being is because the liver actually helps to break down histamine. Histamine, when it builds up in your body, causes all over inflammation. So think joint pain, puffiness, just inflammation, period, as well as asthma and allergies. So by healing the liver now could do its job, filter out my blood, and it could also help to break down the histamine. So I stopped needing allergy and asthma medication. So I went in for one thing, trying to get my skin cleared, and I wound up handling a whole bunch of other issues, including anxiety, including depression, because the parasites, all of the toxins that were giving off were throwing off my hormones. My periods became more regular. And I started having painless, not painful, but painless periods, all because of these stupid little parasites. They throw off your hormones as well. So my cycles were, I had less cramping, less mood swings. The clots were less because the blood clots that you pass during your cycles when you have your period could actually be parasites, believe it or not. Okay. So these parasites can cause a lot of things. So if you have panic attacks, if you have psoriasis, or any of the other symptoms that I have mentioned, including headaches, teeth grinding, and eye floaters, if insomnia, like I mentioned. So if you have any of these issues and you notice that your skin is more itchy, if you notice that you're having a harder time falling asleep, if you notice that your anxiety or your panic attacks are more severe or more pronounced right around the full moon or the new moon, chances are it's parasite related. So, what can you do to get rid of parasites? So, things like wormwood and clove can help, ginger and garlic can help. But what we do is actually we find out which combinations of different supplements and different herbs that your body needs and how much your specific body needs, because each person is going to be slightly different. Each person might need different amounts of supplements. So we make a tailor-made custom program specifically for you rather than doing protocols or say, oh, here, take 500 milligrams of blah, 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 clove or ginger or garlic or whatever it is. We don't do that because maybe your body only needs 300. Maybe your body needs 1,000. So we are able to muscle test and quantum nutrition test to find out specifically which herbs, which supplements, and maybe you don't want herbs. Maybe you want a homeopathic remedy, which, by the way, is really gentle for kids. So, infants, colicky infants, and babies who are very, very cranky, who can't seem to, who get a lot of pain after eating, who can't seem to digest mother's milk might also have parasites as well. And there are safe, holistic remedies for infants. Okay. So if you are interested, or want something, specifically for you to help you with your symptoms, to help you with getting rid of parasites, we quantum nutrition test. So it's a type of muscle testing that allows us to use quantum physics to assess the body no matter where you're at. And this is pretty cool because half of my patients are across the country. So I do see patients in person. If you happen to be in the Chicagoland area and want to come in person, then great. Otherwise, you can actually do this virtually. So if you would like more information on and kind of find out what it is that we do and how we can help your body heal naturally, please give us a call. So our phone number is 708-554-6730. And like I said, we'll make a tailor-made custom program specifically for your body to help you with your symptoms and to find out if you actually have parasites. All right, have a wonderful night, guys. Take care.